So this job that I have that actually made me come back to Indiana, which I'm very thankful for. This is actually the first job where I've ever seen somebody lie on their resume and they end up having the proof that they lied. So there's one thing about being skilled in a certain field. For instance, like the dental field is all about skill. You learn that skill over time. You learn it, and it's okay if you don't know it right away, because at the end of the day, there's people there that have a lot more training, have a lot more skill, and they're willing to teach you if you are open-minded and willing to learn. But there's this thing in this title that's a generalized title. Normally it's not much in orthodontics because orthodontics is just its own category, but if you're in regular dentistry or any other type of specialty, I'm sure it applies the same way. So it's called an EFDA, or an expanded functions dental assistant. So it essentially gives you the certification and the ability to do more complex appointments and help out the doctor more, because he's able to, or he or she is able to trust you more because you know what you're doing. Well, when you lie about that, and when you have a certification that says you are that, but in reality you're not, well, when you go to apply your skills or something, that's when it really shows. And unfortunately, I work with somebody that I think had lied about that. And again, even if they were, an EFDA does not really apply too much in orthodontics. It just doesn't. Because orthodontics, again, is its own specialty. You're bending wires, you're putting brackets on, you're dealing with tooth movement and rotations and deflections and all this stuff. So it's a lot different than just your normal, oh, well, you got to do a crown or a bridge or, some other complex thing of an implant. Or maybe you're dealing with periodontics, which is, your gums, or endodontics, which is root canals and stuff. Or prosthodontics, which is, like dentures and, prosthesis. It's a whole different story. So there's been multiple little appointments that I personally know how to do, and I've done them more than I ever thought I would here, because it's kind of weird. Like I got trained how to do it in Colorado, and then now I'm here and this is what's happening. But it's no hate to the person, because it's at the end of the day, just be honest with yourself, be honest with people around you, to say like what you know how to do, what you don't know how to do. My thing is that it's actually kind of interesting to see it, because it's actually allowing me to see how I can teach people and how I have learned and how I can apply my learning skills and my knowledge to them, and hopefully that they can learn. The only thing is like, obviously when you're, maybe you went to the school, maybe you didn't, whichever. Dentistry is a very complex field where it's very easy, but it's very easy to mess up too. And there's a lot of things to avoid. Like you have your people's lips, each person's like lip design, stretchiness, even their tongue movements and, mannerisms can affect the procedures. And it's one of those things where you have to understand what you're doing, or at least begin to know what you're doing. And I think the best thing to do in dentistry is to teach people hands-on. So say you do one and then you shadow somebody doing another, right? Like when I was in the process of learning how to remove glue from teeth, I wasn't able to use what's known as a debonder. It's basically just, I guess the best way to think of it, it's like a mini drill that just shaves off the glue, and that's it. It doesn't shave off an enamel. You can, unfortunately, do that, but you just shave off the glue. But I was using a white stone, which is essentially like a polishing burr. It doesn't impact the tooth as harshly. So I would start on that, and then I gradually worked up to that, and now it's like to the point where I'm 3.5 years in, or 3 years in, and I'm doing it within 20 minutes because I know exactly what I'm doing. I know exactly what I'm looking for. And then again, it's also about tooth structure and identifying how a tooth looks, and then also how the tooth is designed. So what I mean by that is, okay, do they have fluorosis? Do they have certain chips in different places? Is their natural tooth like actually shaped like this and like that? And there's even, I don't know what the medical term is called for it, but it's one where the tooth actually has a bunch of holes in it, and it makes the teeth really sensitive. I dealt with that one time. That one's scary because that one actually doesn't allow you to see how the tooth is actually supposed to be. So, yeah. But anyways, I just going back to this whole thing of being honest with yourself and knowing what you can and cannot do. I mean, that's the scariest part. Like, it's just you're messing with patients' mouths, and then obviously the doctor's license is on the line. Now, hopefully, maybe this is also a good sign. Maybe it's like a sign of like, hey, hey, dude, like you have the ability to teach people pretty decently complex procedures, and you do it well. So maybe this is a sign for, if I ever do decide to go to dental school and apply for it, that they might see it from like a doctor recommendation, like multiple doctor recommendations, and be like, you know what, this guy knows what he's doing, and he has the passion and the soul and the heart for it. So I would stand by him any single day of the week, and that would be amazing. But now we're going back and forth with dental school because it's just like, again, this big beautiful bill that's passed. I mean, I genuinely, guys, I don't want to be so much in debt. Again, going back to the negative debt versus positive debt, it's such a negative debt, and it's rough to pay off. Like, at the end of the day, I want to do what I want to do for a living to be happy about it, and that's why I'm trying to make these YouTube videos and stuff. But I think also sharing my personal life is kind of interesting because I'm learning about myself as I grow. Like, I used to make vlogs about myself that made no sense, and now I'm 25. This is 10 years later, and I'm like, holy crap, like, I remember recording myself doing that, and now it's at this point where I'm like, I found passions. I found things that I would have never probably ever loved beforehand, and this is where we're at. So, it's crazy, but it's cool. Could I see myself as a DDS? I don't know, man. All the schooling is not easy. But I know if I got there, I would have the support of so many people, and I know I would do such a good job because it's not about the quantity that I want to do, it's about the quality that impacts the person's life. That's, at the end of the day, that's what matters, because in orthodontics especially, you're shaping a person's mouth, and you're shaping the teeth sometimes. You're making them have a better smile, but also a life-changing smile that helps them either eat better, talk better, or just live a better life in general. So, going back and forth, man, it's whatever. But anyways, moral of the story of this video is just that I'm surprised I was even remotely coming across this situation, and hopefully I never do again. But it's just like, you just can't lie about stuff in dentistry, because when it comes down to the time of how to actually do it and you don't, that's a problem.